Hey you guys, it's me Adam Deshaun with another video. So this video is just going to be a quick story time. Those of you guys let me know that you like my story time. So I'm going to tell you this story time video that me and some co-workers were talking about the other day. So this is going to be called the time a patient pooped on me. So, and literally pooped all over me. So I had been a nurse for like maybe a year. I was working at the nursing home. I had a patient. I came in that shift, and the patient, I was working a 3 to 11 shift at the time. The patient had went to the doctor that morning, and the doctor ordered this patient to have a colonoscopy the next morning. Now, a colonoscopy is basically when the doctor sticks a camera with a scope up your butt, and they kind of look around for different like disease, like for cancers or different little things, polyps, which is basically just tissue that may turn into cancer. So with this procedure, your digestive system and your colon needs to be very clean. So the doctors will prescribe you something what we call Golytely. Now, Golytely is a mix of basically Miralax, which is a laxative that draws water into the colon, and it is a bunch of electrolytes. So the orders typically say that you're supposed to drink, it's been a minute since I've given Golytely, but you're supposed to drink it's like a 2-gallon or 2,000 milliliter jug. You fill it with water, you shake it up, and the patient is supposed to drink like a cup of this every 5 minutes or something until they start having a bowel movement. First time that I've ever done this with the patient. So had this gentleman, he was unable to walk, so he was having to transfer from bed to wheelchair to bed. So I instructed the patient. I was like, hey, the doctor's ordered you this. You have to drink a cup of this every 5 minutes until it's gone or something like that. So I started giving him the solution. Little did I know that it produces nothing but, for the first few bowel movements, a lot of liquid and soft stool. So maybe after an hour of me giving this patient the medicine, he called me into the room. He was like, I gotta go to the bathroom now. So I'm like, okay, got you. Let's get you to the restroom. Put the patient in the wheelchair. He didn't make it. He didn't make it to the restroom. And those of you guys who are familiar with wheelchairs, there is the back and then there's the bottom of the wheelchair. But there's a slit in the wheelchair at the back bottom, if that makes sense. You got the back and then you've got a different piece for the seat. I'm standing behind the patient, pushing him to the restroom. He starts to shit, and the poop comes out of the back of the wheelchair all over my non-leather cloth shoes and the bottom of my pants. Shit. Seeping through my cloth tennis shoes, through my cloth socks, onto my bare skin. Was not a good idea to stand behind him while I was doing this. Was not a good idea to wear cloth shoes, which is why they tell you guys wear leather, plastic shoes. Now this is a lesson that I've taken with me. I do not wear cloth shoes to work ever. So this is a lesson. So I had to grit my teeth, still wheel him to the restroom while I'm splashing around in his feces that have soaked into my shoes and through my socks and have saturated my feet and saturated the bottom of my scrub pants. And I had to act like nothing was wrong. So so many lessons learned in this night, you guys. So many lessons learned in this situation. So those of you guys, tell me so if there are you guys who have not, tell me in the comments stories about anytime you guys have had any bodily fluids that were on you. If it's blood, throw up, spit, vomit, poop, pee, put those in the comments. I would love to read about them. Those of you guys who have not already done so, please like this video, subscribe to this channel, and if you haven't done so, please also follow me on Instagram at AdamDeshawn. If you like these videos, let me know in the comments, and I'll see you guys in the next one. Happy nursing. Bye-bye.